Left bundle branch block, or LBBB, is a conduction abnormality in which the electrical impulse is delayed or blocked in the left bundle branch of the heart. This causes the left ventricle to contract later than the right, leading to a characteristic wide and abnormal QRS complex on the ECG. The QRS duration in LBBB is typically greater than 0.12 seconds, or more than 3 small squares, and it shows a broad, notched or slurred R wave in leads 1, V5, and V6. In leads V1 and V2, there is often a deep and wide S wave. The usual septal Q waves in lateral leads are often absent. LBBB can be a sign of underlying structural heart disease, such as hypertension, coronary artery disease, or cardiomyopathy, but it can also appear without obvious pathology. Importantly, LBBB can mask the signs of myocardial infarction on ECG, especially ST elevation, making diagnosis more difficult. In summary, LBBB is recognized by a wide QRS complex with specific changes in lateral and anterior leads, and it often reflects a deeper cardiac issue that requires further evaluation.